Hey, this is Dr. Wade at the American Back Institute, and I wanted to introduce my friend Emily. So, Emily, you were telling me when you first came up here. Tell me what all was going on.
Well, I couldn't hardly walk from the pain in my back. It started in my lower back and it radiated down into my legs. And it was getting so bad that I was having to miss work and nothing was helping.
How far down in your leg did it get?
All the way down to my knees.
So, is it like in the back of your leg mostly?
Mm-hmm.
Okay. So, you said you'd been to how many doctors prior to coming here?
Like 3 or 4 different ones. Even a specialist in Birmingham. They did an MRI and they couldn't find anything wrong.
But you were continuing to suffer and had been there for about 7 years?
Yeah, since I was 17.
Wow. So, that's a long time to hurt. So, how did you find out about our office here?
My dad told me.
And then you came, and so you've been coming here now for about how long?
Probably a couple months. I started October 29th. It's now December 21st.
All right, so in these couple of months, tell me, what have you experienced?
Well, I did nothing but chiropractic for a little bit, and that almost completely alleviated the pain. There was a slight twinge in my left hip for about 2 or 3 weeks, which was considerably better than what I was feeling before. It was very, very slight. And 2 days after starting physical therapy, it was completely gone.
So we just to let people know, we have an integrated multidisciplinary approach dealing with spine problems like what Miss Emily had. What she had basically was officially called sciatica. It was related to a structural problem in her lower back. And we started her on some initial chiropractic care with the intentions of loosening her up and getting her moving better and getting the inflammation down. And it got her feeling better, but we still needed to get things lined up and strengthened. So we've continued to do a combination of chiropractic and physical therapy, and now you've been in the physical therapy now for about a month, I guess. Is that right, or 6 weeks, something like that?
Yeah, 4 to 6 weeks.
4 to 6 weeks, and you're right now. I'm just going to let people kind of see a little bit. We have this aggressive stretching protocol that we utilize. It's actually very, very helpful for reducing tension along the lateral band and the SI joint and the hip. It's a specially designed stretching chair that incorporates an exercise strategy that helps get into specific isolated muscle groups. And basically there's a whole protocol that's geared towards different body parts, whether it's your lower back and hips, or your back and shoulders, or some aspect of your legs, or different parts of that. Now, in addition to that, Emily's been over here on this unweighted table. It uses a uses vibration and an unweighted pulling protocol with manual therapy and some additional exercises. This vibration platform and the chairs over here provide an unweighted distraction and an extension rehabilitative therapeutic activity that combines unweighting the spine as well as it kind of uncoils it. So overall, you've made some really remarkable results, and you're doing pretty good. I'm excited for you.
I know, I'm excited too.
So, a lot of people don't know about what our office can do. Have you ever been to another chiropractor before coming here? Never had been? A lot of people don't really understand, the options that they have and things that can be done to help people. Is there anything that you would encourage them to do to investigate for themselves? Or
Yeah, if you go and get an x-ray and they can't find anything wrong, and you get an MRI and they can't find anything wrong, always just next step, always chiropractor. I'd say chiropractor first for back, having, done all this. None of that other stuff helped.
So you're suffering, and you had told me earlier that you'd been able to ride a bike again, first time in several years.
Yeah, before I couldn't even make it 5 minutes on a bike without suffering severe pain, and it's calmed down considerably. It still aggravates it just a little bit, but I think it's going to get better.
Well, that's all right. I appreciate you sharing that. Thank you.
Mm-hmm.